there's a lot, right? Mental health, substance use disorders, and recovery. I will frequently tell people that I truly believe that mental health in particular is the biggest issue that not enough people are talking about. And then if you combine substance use disorders with the number of people that are still dying from overdoses, how rampant it is, how pervasive it is, and then recovery, people who are on the path towards getting better. So it's anything and everything that falls in those three very large buckets. So if you really think about it, every single one of them could have its own committee and be one of the busiest committees out there. The reason that they're combined is that so many folks that suffer are going through one of the three. A lot of times there's what we call co-occurring disorders, meaning that they're experiencing more than one. I think, well, I have my work cut out for me. We have a mental health crisis in this country that I think is probably unparalleled. And we could spend a lot of time talking about the reasons for that. But I think that's far less important than getting people the help that they need. So if you just look at, last week, the Center for Disease Control, the CDC, came out with a report that I think was absolutely devastating because it spoke about the mental health of kids. And it spoke about mental health, and then it kind of went off on a tangent, a very helpful tangent on adolescent girls. And they did surveys of adolescent girls, as well as all genders, races, et cetera. But adolescent girls in particular were experiencing unprecedented levels of unhappiness, depression, suicidal ideations. So something is going on out there. And the one thing that we know, what the data supports in an irrefutable fashion, is that if you want to help somebody out with a mental health concern, and this obviously goes without saying, but a lot of times policy doesn't reflect this, you need to get them young. You need to get them when it's first starting to manifest itself and folks are starting to demonstrate symptoms. So one of the big recommendations is something you just said. We need to do a much better job with school-based programs. A lot of times, teachers, paras, just folks in school, friends in schools are the people that are going to have the best ability to say, hey, something's going on with John. We should talk to someone about him, or we should talk to him and ask him if everything is going okay. I'm really proud this past legislative session, Massachusetts took a really, really big step. We passed this law, I should say now, known as the Mental Health ABC Act. And the bill was the law was just filled with so many good things. But one of the things that it did was it mandated that insurance companies, just like you would go for a physical health checkup, where you have your blood pressure checked, you'll have your lungs to make sure you're breathing right. But what goes in many instances, beneath the radar is how are you doing, from a mental health perspective. So we said, insurance companies, you are now, for anybody that wants it, we are requiring that you pay for one mental health wellness checkup a year, where the exclusive purpose of that would be to talk to a provider. And obviously, if you've got things going on, to then refer you and get you the help that you need. So there's a lot. I'm humbled because I don't think there's a bigger challenge in Massachusetts. We can talk about housing, we can talk about all these other things, of course. But from a sheer humanity standpoint, you're going to be hard pressed to convince me that something is a larger challenge in Massachusetts and beyond right now than mental health.
And as we know, recently a child took her own life. She had been bullied at school. And for me, and the mother knew that it was happening, and she went to the school and told them, but maybe the school didn't have the competence to know how to deal with that. And if I were the mother of one of the people who had bullied that child, I wouldn't have the competence on how to deal with that child that in some way caused another one to feel so bad about herself she did not want to be in this life anymore. And it just seems mental health is fundamental in this country for everything. We see it in politics. We see it on how we debate each other, how we mock one another, how humiliation is the way to prove that we're better than the other person. And at the same time, Senator, what I'm hearing also, well, all of us are, is that the health community, doctors, nurses, psychiatrists, counselors, there's a shortage of them. They got burnt out during COVID.
Yeah.
How do we buff up? How do we, get the levels up again so that we can address these deep-seated things?
Yeah, that's a really big part of this, right? The workforce shortages. There are not enough people going into this line of work, and that's tied to many different things. The reimbursements from insurance companies just aren't what they are for physical health, and that's a really big problem. We really refer to that as the mental health parity laws, and we do have good laws on the book, but there still have been countless examples of insurance companies finding a way to kind of navigate that and just make it so they just don't have to cover a lot. That's a much larger discussion, but it's certainly a problem that's out there. Look, it's part of this, I think, and this is where we can come in, and we did some of this in the Mental Health ABC Act. So you've got this workforce shortage across the Commonwealth of Massachusetts, and it's even more pronounced here in Western Massachusetts. So we need to even get more creative. And some of the ideas that have been floated and some of the things that we did last legislative session is offering, financial aid, financial loans, loan forgiveness for folks who decide to go into these fields. Now, one of the things that I'm kind of battling around in my mind right now is, can we kind of expand on that and say, all right, well, we're already giving you assistance if you go into these fields. Well, now we'll do it if you stay in certain areas, i.e. Western Massachusetts, we'll give you additional funds to do something like that. The current system is not sustainable. We are in a crisis right now. You're seeing suicide rates up. You're seeing, again, the depression, the anxiety, really across the whole spectrum of mental health concerns that are out there. There's an uptick in those numbers. And I think it's not to be redundant, but so much of this is meeting people where they are, right? And one of the things we know from like the VA, for example, is that so many of the veterans, we still have a situation right now where 20 to 22 veterans a day are taking their own lives. And if you dive into that data, one of the things you'll see is that many of them were not enrolled in the VA health system. And that's a really big problem, right? Because those are the doctors and the providers that have the most contact and the most understanding of veterans. They can spot those red flags. These veterans were not in the process. They were not in the system. So how do we as a society go out and really meet people where they are? People are going to get real sick and tired of me over the next 2 years saying we need to meet people where they are, whether it be schools, whether it be the VA, whether it be wherever they are. We need to go to them and say, hey, if you need help. The three most courageous words, in my opinion, that a human being can say is, I need help. It's just very challenging to do, difficult, but it's the most, and what's ironic about it is that people think that some people, I should say, think that they're demonstrating weakness when they say that, when in actuality, they're doing the most courageous thing in the world. Because what we know with absolute certainty, with evidence, is that more people need help right now than they did, say, 10, 15 years ago. We just need to figure out who they are and how to get to them and bring them into the process. We talk about stigma a lot in the world, right? There's stigma in the substance use disorder realm. There's absolutely stigma in the mental health world. And, I guess I can finish with this stat right here. The largest mental health providers in America right now are two places: jails and prisons. And to me, that is an indictment of society. It is a failure of society, and we can and must do better.